Hello, Cardiology Update viewers, listeners, and readers. My name is Chadi Alraies, cardiologist at Detroit Medical Center, director of the Cath Lab at Detroit Medical Center, Detroit, Michigan, United States. Coming to you today with another video related to TAVR and leaflet thrombosis. As we know, this is a problem that has been raised several years ago and has indication for possible association with stroke or neurological deficits. And this trial that was published at the JACC journal, the authors compared edoxaban compared to dual antiplatelet therapy and evaluated patient post-TAVR implantation after 6 months with a highly sophisticated and high-quality CT scanner. Evaluation was for valvular as well as perivalvular thrombosis, a term called HALT, hyperattenuated leaflet thickening, and if there is any clinical implication of this thickening or thrombosis on neurological deficit in these patients. Interestingly, 211 patients were enrolled in this trial. And after 6 months, when they did this evaluation with a high-resolution CAT scan, there was a rate of 47.1% of thrombosis. And if we look deep into the details, 13% had leaflet thrombosis, and the rest of the patients has perivalvular, either on the above or below the valve, sub or supravalvular thrombosis. The predictors for thrombosis were patients with a lower body mass index or lower weight, as well as a smaller valves implantation, that as has been shown before as well. Interestingly, these thrombosis, either it is on the leaflet or supra or below the valve, did not have any clinical implication, meaning there was no clinical deficit, neurologically deficit such as stroke, vision issues, or any clinically significant neurological abnormalities in these patients. So the conclusion of this trial was, in patients who undergo TAVR, definitely there is a risk of thrombosis. Dual antiplatelet therapy still continue to be the recommended therapy in these patients as a standard of care, usually aspirin and clopidogrel in our practice here in the United States, as well as there is no clinical implication, meaning even if we look for these thrombosis and on a CAT scan routinely, it's not really a routine practice that's recommended. It's going to show that there is thickening in the leaflet. It will show that there's thrombosis above or below the valve. However, will not have any clinical implication such as neurological deficit in this patient. I hope you enjoyed this review. Hope you can join us and follow us on social media as well as on the website. I am Chadi Alraies and this is Cardiology Update.